I'm not going to introduce Ethan Nadelman because you have it in your program, but I would like to thank him. We met in 2002 at a Drug Policy Alliance conference in Albuquerque, and shortly after that, with some friends here, I had the thought we need to have a program at the Baker Institute. And so we said, I was told you must be in contact with Ethan about this. And so Ethan helped me know who were the right people to invite. He helped was responsible for helping us raise the money to have that conference. And if you go back to, I think it's in February 2002, it was in 2002, I know. It was a 2-day conference, and we had some real stars at that, and it really put the stake in the ground for our program here. And Ethan has been a great friend of the program and has spoken at other times as well. So I just want to thank you, and again, welcome you to the Baker Institute.
Thank you, Bill. It's been a pleasure, and I really appreciate the leadership you provided here at the Baker Institute and also in Texas. So, being from New York and having a lot to say, all I can just say is hang on, because I'm going to talk pretty fast right now, and I apologize to all of those of you for whom English is not your first language, but here we go. First of all, let me put this U.S. thing in some global and some historical perspective. The first thing I think it's important to know, and so I think many of you now know this, right, that the United States is extraordinary in one terrible regard, which is that we have less than 5% of the world's population, but almost 25% of the world's incarcerated population. Right? We have the highest per capita incarceration in the world, the highest per capita incarceration rate of any democratic society in history, the rate at which we lock up black people in this country. It makes the Soviet gulags look like child's play in comparison, and apartheid South Africa like nothing in comparison as well. We lock up more people on drug law violations in the U.S. than all of Western Europe, by which I mean the original EU countries, locks up for everything, and they have 100 million more people than we do, right? And it's not because we have so many more criminals or because we use so many more drugs. In point of fact, our rates of drug use, illicit drug use, are not that different than much of Europe. Our rates of crime, especially nonviolent crime, not that different, but we become dependent upon the criminal justice system as a form of political and cultural crutch that has had devastating consequences in this country. That's the first thing. And part of what drives me, the number one thing that drives me, is just a sense of shame as an American that our country should hold that distinction. That seems wrong. The second thing I just want to say is that when it comes to the global war on drugs, we have been the driving force for almost a century, right? We have been the champion. We have shaped the global conventions. We have pushed through bilateral and multilateral relationships for other countries to follow in our footsteps. The number of countries that decided to criminalize marijuana decades ago without ever having heard of marijuana. U.S. wants it, we'll do it. And without realizing the consequences that would follow. Our Federal Drug Enforcement Administration, the first global police force, we have played a major proactive role in that regard in ways that's beginning to change. But it's important to understand that global role there. Third thing, and this is the one which I know none of you are going to believe me with, but I just got to say it, that there is no real solid basis in science, in medicine, in ethics, or even in the Bible for that matter, for distinguishing between alcohol or tobacco on the one hand and marijuana, cocaine, heroin, methamphetamine on the other. There is no basis in medical science, you name it, for just saying that if you're, God forbid, a parent with 2 kids who are an addict and one's addicted to booze and one's addicted to heroin, that this one's going to be dealt with fundamentally different than that one, even though any physician in the world will tell you that heroin in its pure form is dramatically less dangerous to the body than is the alcohol. There is no basis. There was no point 100 years ago where some wise National Academy of Science looked at all the drugs and says, well, we got to criminalize those ones, but not those ones. What determines why some drugs are legal and others not has almost nothing to do with the relative risks or dangers of those substances, and almost everything to do with who uses and who is perceived to use those substances, right? In the late 19th century, when most consumers of opiates in America were middle-aged white women, nobody thought to make it illegal because nobody wanted to put grandma or auntie behind bars. But when the Chinese came to the country, working on the railroad, smoking that old opium at home, that's when we got the first criminal prohibition laws. With cocaine, Coca-Cola had cocaine in it until 1900. And so far as we know, it was no more addictive back then than Coca-Cola with caffeine is today. We didn't think to make it criminal until black people in the South started using that drug, and the fear was, what would those black men do in Jim Crow America? The first marijuana prohibitions, hey, first one, El Paso, Texas, 102 years ago, the first municipal ordinance criminalizing marijuana, all about prejudice against Mexican Americans. All of the first marijuana prohibition laws were in the Midwest, the Southwest, and the Western states, driven by prejudice against Mexican Americans, Mexican migrants, right? Understand that that is what has driven it. And when we look at the way this thing has manifested, it's also what continues to give it that force. I know this is hard to believe. I know you say, but methamphetamine, heroin, come on, alcohol. Line up the scientists, line up the physicians, just go to research, do a master's degree on this issue, read everything you can, and you'll see what I'm talking about. Now, that said, what I want to focus on is reform and put this U.S. thing in a little more of a global context, because there's really three major pockets we're talking about here. The first one is Europe, right? And it's oftentimes a mistake to look at this as a north-south thing, U.S., Latin America, which is inevitable in many respects. But Europe is a place that 30 years ago, 40 years ago, 20 years ago, pioneered a public health approach to dealing with drugs. They're the ones who said we're going to treat drug use and addiction as health issues, not criminal issues. Yes, we'll still arrest the drug dealers and put them in prison, but we're going to treat drug use and addiction as a health issue. When HIV/AIDS started spreading by and among injecting drug users, it wasn't just left-wing governments. It was Margaret Thatcher 30 years ago saying we have to legalize needle exchange in order to reduce the spread of a terrible disease for which we have no cure. It was the conservative Swiss, backed by the bankers and the cops of Zurich, saying we got to figure out this heroin thing. If this means allowing heroin addicts to come to a clinic and get legal heroin in a clinic and giving them the services to help get their lives together, so be it. That's what we're going to do. It was in Portugal making a national change of policy 13 years ago to say we're not going to put anybody in jail for simple drug use or possession. More or less what Diego's described in Uruguay as the 40-year policy, right? That if you're really a bad guy, we'll catch you for something else, but we are not going to put anybody in jail for drug use or possession. We're going to try to figure out what the problem is and help those people. We're not even going to drug test them. We're going to focus on helping them one way or another. So the European model of treating drug use and addiction as a health issue, educating Americans, that's been a major mission of mine, notwithstanding the monumental American resistance to learning about anything from outside the country, as if whether it even exists outside the country, right? But the fact of the matter is the Europeans are doing some things very well. To the extent that we've imported those things, the Latin Americans have, it's been a major success in terms of improving health, reducing crime, and reducing the fiscal cost to the taxpayer. Now, in Latin America, apart from Uruguay and a few other places, it's been driven by the elites. I've been deeply involved in advocacy in Latin America. It started back in 2007-8 with some ex-presidents, Cardoso from Brazil, Gaviria from Colombia, Zedillo from Mexico, a whole bunch of other distinguished Latin Americans, creating a Latin American Commission on Drugs and Democracy and saying we need a new way, we need to break the taboo on looking at alternatives to drug prohibition. They followed that up with a global commission into which they enlisted European presidents as well as George Shultz and Paul Volcker and Richard Branson and a range of others. And that commission came out with a report in 2011 saying we need to end marijuana prohibition, we need to end the criminalization of drug possession, we need to shift from a criminal justice frame to a public health frame. And then they said, it's all good for us ex-presidents to say this, what about the current presidents? And that's when President Santos and Otto Perez Molina bravely stepped up, and then a year later, President Mujica in Uruguay, specifically on the marijuana issue, and even Calderon in Mexico, pushing that Mexican drug war, but meanwhile whispering to people, wouldn't legalization really be the answer here, right? So we had a largely elite-driven strategy, which is now growing. President Lagos, former President Lagos in Chile, and a whole range of others stepping up, saying we need a different way. Now, in the midst of that, our country, America, here we are. I've been going around the world for 25 years and opening up my speeches by saying, I want to apologize as an American for the havoc that my government has wreaked all around the world with our failed war on drugs. Look at the 100,000 dead in Mexico over the last 8-9 years in prohibition-related violence. Look at the massive corruption and violence and trafficking and empowerment of gangsters throughout parts of Latin America and Colombia, Bolivia, Peru, in the Caribbean, now spreading to West Africa, parts of Asia. I apologize as an American for the harms we've done with our moralistic, pseudo-moralistic, ideological war on drugs that's been indifferent to the consequences for so many other nations. But now, I get to stand up, and I get to say, I am an American, and I am proud that we are leading the world in transforming policies regarding marijuana. And we may not be leading at the federal level, but at the level of civil society, state government, and public opinion through the initiative process and the state legislative process. We are leading the world. We are providing a model for dealing with one pivotal part of the war on drugs. It's not the part that's filling all our state and federal prisons, but it is the part that accounts for half the drug arrests in America, half the drug arrests all around the world, for filling local jails, for giving tens of millions of people criminal records, for doing all sorts of horrible things to people, keeping them from pursuing their life, just because they want to be one of the 40 or 50% of Americans who have smoked a joint or possessed a joint at some point, right? It began with medical marijuana back in the late 90s, and I and my organization have driven a lot of these ballot initiatives around the country. And we pursued medical marijuana for two reasons. First, because we believed that the persecution and prosecution of people who really used marijuana for medical purposes was the most egregious aspect of the war against marijuana. But there was a second reason, our hope that it would help transform the national dialogue around marijuana. And that, in fact, it did. They did both of those things. So beginning with California in '96 with a very loosely written law, following up with much more tightly written laws in other states, now almost half the states in the United States, right, have medical marijuana that's legal. Millions of Americans have a legal medical marijuana recommendation or ID. You have a bill in your state legislature, I'm not holding my breath, but it's opening up the discussion, and there are Democrats and Republicans talking about moving this thing forward. In Utah just last month, a Mormon senator descended from Mormon royalty introduced a medical marijuana legalization bill. It missed by one vote of getting through the Utah State Senate, and many of those who voted against it said if they don't have a little more time, they would have voted for it. It's going through next year. Public opinion polls showed 70% of Utahns supporting this and a majority of Mormons supporting the legalization of medical marijuana. So the country is changing, and it's not just America. The two countries with the best regulated medical marijuana systems in the world, Canada and Israel, both headed by right-wing politicians, but nonetheless the most well-regulated systems. Other countries. In Latin America, Chile just harvested the first medical marijuana crop in Latin America last week. Uruguay, Argentina, Brazil, Costa Rica, all with bills. Jamaica just moved forward as well in a bigger way to legalize it to some extent there. The fact is, public opinion has transformed remarkably rapidly in this country. You line up the Gallup polls on legalizing gay marriage and legalizing marijuana, and they line up almost exactly from 2004 to 2014, from 34% to 50%, 54% more or less, right? If any of you saw Sanjay Gupta, the CNN special last night about marijuana, it's been playing over and over and over. I've been in airports the last few days, and CNN's on every airport in America, and you could not turn around without a marijuana leaf on your face on TV as they're promoting these programs. But the fact of the matter is the culture is changing around this marijuana issue. I don't know if it's inevitable. Part of my job is to worry about the fact that it might not be, the fact that all the people beginning to make money in this marijuana industry are just kind of harvesting the fruits of what people like me did for civil rights and civil liberties reasons, and they're not investing the money to try to keep this process moving, or when they do invest it, it's just for their own pecuniary interest. So there's a whole new struggle happening right there, right? But the fact of the matter is, I think we are on the way. Even a majority of Americans who oppose legalizing marijuana now believe that it's inevitable. And what Fernando Carrera said when Obama and Attorney General Holder in mid-2013 issued a green light, or a qualified green light, for Colorado and Washington to implement their new legalization laws and according to a set of criteria, that was huge. And it was huge internationally, Because once Attorney General Holder said, we're going to give Colorado and Washington, now Oregon, Alaska, a chance to do that, well, then they had to extend the same courtesy to Uruguay and other foreign countries. And once they did that and couldn't figure out how to admit that the U.S. was now in violation of the global drug control conventions we had created, at that point, the State Department had to issue a new doctrine, basically saying that for the first time in 100 years, the U.S. now supports a flexible interpretation of the international conventions and a policy of tolerance for other countries doing things different ways. So that little change in those two states of 4 million people a few years ago created a change in a 100-year global U.S. drug policy. Now, here's the thing, and I'll close with this. The challenge that I'm confronting running the leading drug policy reform organization, there's momentum on rolling back incarceration in this country as well. Right? I mean, and there's momentum on the marijuana piece, on rolling back. People understand there are left-right coalitions emerging, based out of here, Texas, right on crime. Almost every prominent Republican politician in America is now part of a right on crime coalition to reduce incarceration for both Christian reasons, moral reasons, and fiscal reasons, right? Your governor, Rick Perry, showed up at the Davos World Economic Forum Summit last year and found himself saying he supported decriminalization, alternatives to incarceration, all this sort of thing. He had to back down a little bit when he got back home. But nonetheless, the fact that Republican candidates with national aspirations are now saying, I support reducing the prison population, that shows something. That shows the country is shifting. The problem is we're talking about a monumental amount of people behind bars. And what's going on now with the incremental things has got to be part of the process. We got to stop building out the geriatric part of the prison population. We got to shift parole and probation. We got to do those sorts of things. But here's the piece that I'm deeply invested in. So long as we continue to treat drug use and possession as criminal matters, for every 2 steps forward we take in reducing incarceration, we're taking 2 to 3 steps backward in terms of just feeding people back into the system. So long as we continue to believe that anybody who uses drug X, Y, or Z as opposed to A, B, or C ultimately deserves to be punished, to lose their home, their children, their property, and their freedom because they refuse or are unable to be abstinent from drugs X, Y, and Z, we are doomed to keep failing in our efforts. If Europe can end the criminalization of drug use and possession, if Uruguay can do the same thing, if other Latin American countries do the same thing, either for juridical reasons or political reasons, and they can do those things at the same time that they keep drug use low, deal with addiction more effectively, keep crime down, all more effective than we do, then there is no good reason to do that. There is no good reason to be distinguishing in our laws or in our consciousness between the person who has a problem with that drug or a problem with that drug, or a person who uses that drug responsibly, person uses that drug responsibly. We need to move in that direction. Now, the movement on marijuana reform has created a rising tide, real momentum. The reduction of prison population happening here and there. Even the talk Texas has been pulling down its population, not as fast as we've done in New York and New Jersey, but it's coming down a bit, right? The marijuana thing. But here's my fear, and this is tactically and politically. The marijuana reform thing has given a sense of momentum. Now all the attention's on the new industry, the money to be made, taking it out of the prohibition system. But the fact of the matter is, to some very good extent, we're never, or not in any foreseeable future, going to land up legalizing cocaine, heroin, or methamphetamine the way we do marijuana because of the public health risks, because of the public perceptions, because the public opinion is not there, whatever it might be. That means, what do? How do we tie together the problems of consumption in our country and growing global consumption together with what's going on to the objective of trying to take the narco-traffickers and all the corruption and violence out of the picture? Well, legalizing marijuana, taking that out of the drug prohibition system, that's one relatively easy piece. Ending the criminalization of drug possession, which has no impact on the number of offenders but allows us to shift resources, is a second piece. But the third piece is going to be the toughest. And it's the long-term agenda for reform. 20 years ago, the Swiss said, we got these heroin addicts running around town, making us look bad, committing crimes for their habits. We've tried everything, drug-free treatment, methadone, everything, doesn't work. Okay, we're going to allow them to come to a clinic where they can get legal heroin up to 3 times a day. They can't take it home, they can't do this, right? Turns out, when they did that program, crime dropped, drug markets dropped, health improved, HIV and Hep C declined. Many people were in the program, now they had their dream come true, free heroin. 30 to 40% of them finally decided, I don't want to do this anymore. It was the first time they'd been able to look in a mirror and going, what am I doing? You know, we're so used to in America, you got to punish people with that judge with that hammer. You better get clean or I'm going to ship you away. Well, it turned out that giving people a chance to look in a mirror without being forced by anybody to quit worked better than what we're doing here. And it saved taxpayers money, and it reduced crime, and all the cops got behind it. Then the Germans and the Dutch and the English and a whole range of others began to do the same thing. Now they're doing it up in Vancouver as well. Ultimately, you know where this all goes? If we really want to take this war on drugs domestically, internationally, and turn a huge problem into a minor problem, it's not just legalizing marijuana. It's not just reducing overall incarceration. It's just not just making the sentences a little more rational. It's not just ending the criminalization of possession. In the long term, we need to figure out how those people who are determined to use drug X, Y, and Z, and who will do so, whether it's legal or illegal, we need to figure out a way, if those people can't be helped with treatment, can't be helped with job opportunity, can't be helped, we need to figure out a way where those people can obtain the drugs they want or need from a legal, regulated source in such a way that it does not endanger the broader public health and safety of this country. That conversation is not happening here. You're getting a preview to a conversation that's going to be rolling out in 5 and 10 years from now. But the faster that we have that conversation, the faster we get smart and rational, the faster we get realistic about what it means to keep our kids safe in a world where the biggest threats are not marijuana, but booze and cigarettes and especially pharmaceutical drugs. The faster we get smart, the faster we can put this monumental, colossal waste of human lives and resources behind us. Thank you.